Welcome back. It is probably one of the most underreported crimes that's happening in Kern County, and you might not even be aware of it. We're talking about health insurance fraud. Joining us in Studio B to shed a little light on this is Deputy District Attorney Andi Bridges, part of the fraud unit. Thank you for coming in.
Thank you for having me, Mike.
First of all, can we call it an epidemic? When we're not quite sure, when we don't have the hard numbers yet?
Well, I think we do have the hard numbers. Nationwide, we're looking at a minimum of $68 billion a year in fraud, and that is a conservative estimate. We can be upwards of $200 billion. That's an epidemic.
Okay, let's begin with just simply what it is when we're talking about this specific type of fraud.
Well, there's two sides to this coin. You have the provider fraud, and then you have the insured fraud, which often comes with disability insurance, with people seeking insurance for ailments they already may have. But the provider fraud is really where we're seeing the biggest numbers be generated. Now,
are you starting to see more and more people start to report this? And how, as a patient, let's just say, from the health side of it, how do I spot it? How do I see it?
I think we are seeing more reports of it because at the end of the day, fraud is the crime that we all pay for. And so when it hits our bottom line, we want to tell somebody. You can report it by looking at your explanation of benefits forms. Those are something that you get that most of us throw away.
Oh, that envelope.
Yes, that envelope. Don't throw it away. Take a look at it. There are CPT codes on it. They are 5-digit numbers. You can Google those numbers and determine if your insurance is being billed for the treatment that was actually received by you.
So you go back and say 3 months ago, I was in there to be seen for this. I Googled the code, but it was reported as that.
Absolutely.
It's that easy.
It's that easy.
Okay. And we just saw, we were talking about opioids. There was the major bust by the feds, 400 arrests, millions of pills seized and whatnot. We're talking about opioid, not on that level, obviously, locally, but Kern County we're still up there in the numbers?
We are in the worst 25% of the 58 counties in California for opioid abuse and opioid-related deaths.
Okay. And can you just expand a little bit more on that when you're talking about it and being more aware of that sort of thing, especially when it comes to opioids, because you're really trusting the provider, the person that's prescribing it to you.
Absolutely. And so people are being taken advantage of. They're relying on these doctors to do what's best for them when sometimes these doctors are doing what's best for themselves and lining their pocket. Okay.
This is obviously a topic that we're really going to start to hone in on, because November is Fraud Awareness Month, I believe we're saying. How can people report it?
People can report it directly to us at kerncountyfraud.com. On our website, there are also links to the California Department of Insurance, with whom we partner and who partially funds my position.
Wonderful. Andi Bridges, thank you for coming in, and please come back.
Thank you, Mike. My pleasure.
All right.